That bottle of mouthwash sitting on your bathroom counter right now, the one you use every morning to fight the dry mouth you wake up with, it is making your dry mouth 3 times worse, and I can prove it. A major study just found that alcohol-based mouthwash, the brand millions of people trust, is destroying the exact bacteria your mouth needs to stay moist. You are pouring the problem right into the problem every single day. Now, I'm going to show you exactly what to use instead. And I'm going to give you a complete morning and nighttime protocol that can restore your mouth's natural moisture in as little as a few weeks. But if you don't understand the root cause I am about to explain, nothing I give you today will work. So stay with me. These next few minutes could change everything. Hi, I'm Dr. Sarah. Welcome to the Senior Health Podcast. If you're new here, I'm a geriatric specialist, and this podcast is my way of fighting for you because I believe your pain has been ignored for far too long. I want to tell you about someone very close to me. Her name is Margaret. She's 68 years old, retired school teacher, 32 years in a second grade classroom, the kind of woman who could talk to anyone about anything. About 2 years ago, Margaret started waking up every morning with her tongue stuck, literally stuck to the roof of her mouth. Her throat felt like sandpaper. She would cough and gag trying to swallow her morning coffee. And the taste in her mouth? She described it as like something crawled in there and died overnight. But here's what really broke my heart. Margaret stopped hosting Thanksgiving dinner. For 20 years, her house was the place the whole family gathered. But last year, she told her daughter she just wasn't feeling up to it. The real reason? She couldn't eat the food anymore. Dry turkey, crusty bread, her famous pecan pie, everything stuck in her throat. She was terrified of choking in front of her grandchildren. She went from the heart of her family to silently watching from the sidelines. And that is not okay. But then I discovered something about what was really happening inside Margaret's mouth. Something her doctor never mentioned, and everything changed. I'm going to share exactly what I found with you right now. Before I show you the solution, I need you to understand why this is happening inside your body. And here's what honestly frustrates me. Most doctors will look at you, a patient in real discomfort, and say, well, you're 68. Your mouth gets drier with age. That's normal. That is lazy medicine. That is an excuse, and it is wrong. Here's the truth that changes everything. Multiple research studies have confirmed that healthy salivary glands, even at age 70, 80, 90, still produce enough saliva to keep your mouth comfortable. Your glands are not broken. Your body is not falling apart because of a number on a calendar. So what is happening? You have 3 major pairs of salivary glands. Think of them as 3 little sprinkler systems inside your mouth. They want to keep things moist. But right now, 3 things are blocking them. Number 1, medications. If you take blood pressure pills, antihistamines, antidepressants, or bladder medication, those drugs are chemically blocking the signal that tells your glands to produce saliva. It is like someone turned off the faucet handle. But the pipes are perfectly fine. Number 2, you are likely mouth breathing in your sleep without knowing it. And when you breathe through your mouth all night, the moisture evaporates faster than your glands can replace it, especially because saliva production naturally drops to almost 0 during sleep. Number 3, and this is the one nobody talks about, reduced blood flow. Your glands need good circulation to do their job, but a molecule called nitric oxide, which keeps your blood vessels open and flowing, drops dramatically after 60. Less blood flow to the glands means less raw material for making saliva. Now, here is the part I love. Are you ready? Imagine your salivary glands as a sponge. Right now, that sponge is dry. It is stiff. It feels like it has been sitting in the sun for months. But the sponge is not ruined. The moment you squeeze it under running water, it softens. It plumps back up. It works again. Your glands are that sponge. We just need to get the water running again, and I have the clinical proof that this works. A study published in Geriatrics and Gerontology International took a group of older adults with documented low saliva production and taught them a simple gland massage technique. The result? Their resting saliva flow more than doubled. I need you to hear that number again. Their saliva production more than doubled, not with surgery, not with expensive drugs, with their own 2 hands. So let's get into it. This is your morning mouth revival. 3 things you will do every single morning, starting tomorrow. All seated, all simple. Total time, about 8 minutes. Exercise 1, the gland wake up, salivary gland massage. Sit comfortably in your chair. Place the pads of 2 fingers right in front of your ear, along the jawline. Feel that soft area? That is your parotid gland, your biggest saliva producer. Now press gently but firmly and sweep your fingers forward along the cheekbone toward the corner of your mouth. Like you are squeezing toothpaste out of a tube, slow and steady. Do this 10 times on each side, about 1 minute per side. Next, move your fingers under your jawbone, near the back corner of the jaw. Press up and sweep forward toward your chin. 10 gentle sweeps each side. That is your submandibular gland. Here is exactly what you will feel. Within about 30 seconds, you will notice a small burst of saliva pooling under your tongue. That is the glands releasing. That warm, wet feeling is the signal that your sprinkler system is turning back on. If you feel a sharp pain, stop. Gentle pressure only. Want to make this even more powerful? Hold a warm, damp washcloth against your face for 2 to 3 minutes before you start. The heat loosens everything up. Exercise 2, the tongue pump, oral muscle activation. Still seated, close your mouth. Press your tongue firmly against the roof of your mouth, like you are trying to push through to your brain. Hold for 5 seconds. Release. Repeat 15 times. This directly activates the nerve signal that triggers saliva production, the same signal those medications are blocking. Then, sweep your tongue in a big circle along the inside of your lips. 10 circles clockwise, 10 counterclockwise. You will feel your mouth starting to water by the 4th or 5th circle. That is exactly what we want. Total time, about 2 minutes. You can do this in the shower. You can do this while the coffee brews. Nobody even needs to know. Kitchen remedy, the green tea reset. After your massage and tongue exercises, brew 1 cup of green tea, not black tea, not herbal, green tea specifically. Here is why. Green tea contains a compound called EGCG that has been shown to protect your salivary gland cells from oxidative damage and boost oral enzyme activity by up to 268%. 1 cup in the morning, 1 in the afternoon. Use loose leaf or bags, both work. 1 teaspoon of raw honey stirred in gives you extra coating and antimicrobial protection, about 8 fluid ounces per cup. If you take blood thinners, check with your doctor first because green tea can interact with warfarin. Now, this next part is my favorite. These are the things you will do tonight, right in your bed, right before you close your eyes. They are gentle, they are calming, and they will work while you sleep. Step 1. The baking soda rinse. Before you get into bed, mix 1/4 teaspoon of baking soda and 1/8 teaspoon of salt into 1 cup of warm water. Swish gently for 30 seconds. Spit. Do not rinse with plain water after. This simple mix mimics your saliva's natural chemistry. It balances your mouth's pH and creates a protective buffer all night long. This is the same formula recommended by Memorial Sloan Kettering for their cancer patients dealing with severe dry mouth. If it works for them, it will work for you. Step 2. The nighttime shield, xylitol discs. Have you ever heard of xylitol? It is a natural sweetener that does something remarkable. It triggers the same nerve pathway that tells your glands to produce saliva, and it keeps working for hours. There are small adhesive discs called xylomelts that you stick against your gums before sleep. They slowly dissolve overnight, keeping your mouth moist while you are completely unconscious. About $10 for a pack of 40 at most pharmacies. Safe with dentures. Safe with CPAP machines. Step 3. Bedroom humidity. Run a cool mist humidifier in your bedroom. Your mouth loses moisture to dry air all night. A humidifier adds that moisture back into the room so your body does not have to fight the environment. Clean it weekly. Mold in a humidifier is worse than no humidifier at all. And sleep on your side rather than your back. Back sleeping lets your jaw fall open and everything dries out twice as fast. Now, knowing Margaret, I know exactly what some of you are thinking right now. What if I'm on blood pressure medication or antidepressants? Should I stop them? Absolutely not. never stop your medication because of this podcast. The beautiful thing about this protocol is that it works alongside your medication. Remember, 75% of patients with medication-related dry mouth improved even while continuing their prescriptions. This protocol supports your glands despite the medication blockade. What if I've tried biotin and it didn't help? I hear you. Biotin is a temporary coating. It does not address the root cause. What I just showed you is fundamentally different. We are retraining the glands to produce their own moisture again through massage, nerve activation, and reducing the chemical interference. Give this protocol 2 full weeks before you judge it. What if I'm over 80? Is it too late? Absolutely not. The research shows that even at 80 and 90, salivary glands retain functional capacity. The sponge still works, remember? It just needs the right stimulation. Start gentle, be patient, and you will feel a difference. And I want to be completely transparent with you right now. I am a doctor, but I am not your doctor in this video. These remedies are powerful. I have seen them work on Margaret and on hundreds of patients, but they do not replace your personal medical care. Please, always talk to your physician before starting anything new. And whatever you do, never stop your medication suddenly without your doctor's guidance. Okay. Before I let you go, there is one thing I desperately need to warn you about. This is the mistake that will undo everything I just taught you, and I promise you, almost every single person watching this right now is making this mistake. Every single day. Alcohol-based mouthwash. I know, you have been using it for years, maybe decades. You use it because your mouth is dry and your breath is bad. And it feels like the responsible thing to do. But here is what is actually happening inside your mouth every time you swish that blue or green liquid around. First, the alcohol is a desiccant. It literally strips moisture from your oral tissue. For someone already struggling with dry mouth, that is like throwing sand on a desert. Second, and this is the part that shocked even me, a major study found that daily use of alcohol-based mouthwash destroys your beneficial oral bacteria, the good bacteria that your body needs to produce nitric oxide. Remember that molecule I mentioned that keeps blood flowing to your glands? Gone. Wiped out. And in their place, harmful bacteria linked to gum disease and inflammation flourish. So the trap is a vicious cycle. Dry mouth causes bad breath. Bad breath makes you use mouthwash. Mouthwash dries your mouth out more and kills the bacteria you need. Worse breath, more mouthwash, drier mouth, round and round. The fix is simple. Switch to an alcohol-free mouthwash. Brands like Biotin Dry Mouth Rinse or Closis. Or use the baking soda rinse I taught you tonight. That single switch can make a noticeable difference within days. So remember, massage your glands every morning to wake them up. Protect your mouth every night with the baking soda rinse and xylitol discs, and throw away that alcohol-based mouthwash today. Start tonight. Your mouth will thank you by morning. Now, your dry mouth is your body's early warning signal, and if you are not protecting the circulation and nerve health behind it, things can get worse fast. To protect your heart and keep your independence for years to come, you need to watch what I prepared for you right here on your screen. I'll see you there.